Well, thank you for joining us today as we recognize Rare Disease Day. Today, I've asked the President of and CEO of CORD, the Canadian Organization for Rare Disorders, to join me to help mark Rare Disease Day. I'd also like to thank our critic, Jeff York, for joining us today, as well as some of the other patients here in the room. In fact, I've just come from the House where I introduced an act to proclaim Rare Disease Day for first reading. Many of you may be starting to become familiar with the stories in this media studio of rare disease patients that are behind the driving force behind my work for Treat Rare Disease across this province. The truth is, however, that while there are 1 in 12 Canadians affected by rare disease, many in the public, the media, and in government are unaware of the challenges patients face across the province to diagnose and treatment. There are actually over 7,000 recognized rare diseases, and yet despite those growing numbers, rare disease patients are most often forced to suffer in isolation without the support, awareness, and resources available to those with more commonly diagnosed diseases. The designation of Rare Disease Day is one way we can work to build that support and awareness. Internationally, Rare Disease Day is celebrated the last day of February. This year, today, February the 29th, a rare date in itself. And while we see today some acknowledgement from this government on the need to address the challenges faced by our rare disease patients, it's my hope that through provincial recognition and designation of Rare Disease Day in Ontario, we can help move that acknowledgement to action and the answers sufferers deserve. So thanks for coming out, and I'll ask Durhane to speak to the need for designation of Rare Disease Day here in Ontario.
Thank you very, very much. And first of all, my huge thanks to Michael Harris for having taken on this tremendous challenge on behalf of all the patients and families living with rare diseases in Ontario. But certainly we know that the reverberations from Ontario will have resonance across Canada and even internationally. And certainly our huge thanks also to the Conservatives for having always been with us as we're trying to move this issue forward. I think, as Michael says, there's nothing more lonely and nothing more alone than to be a parent who's told that your child has a rare disease, or in many cases, as was our family, having a child in which the disease was actually undiagnosed. So you know you've got a problem, but you don't have a name for it, and you don't know what, in fact, the prognosis is going to be. And this is a challenge that is faced by a good 1/4 to almost 1/2 of patients with rare diseases. Rare diseases is a genetic condition, means that 80% of them will have a genetic link to it. But that being said, about 50% of the cases occur in families in which there's no known history, because the genetic defects can actually happen spontaneously in the parent or in the child. So quite frankly, this is why we say rare diseases is actually a tremendously huge public health issue. As Michael says, affects 1 in 12 Canadians. 60% of them are children. A good third of those children will die before the age of 5. I mean, can you think of any other disease category in which we would allow that to be a standing statistic? I think not. And we do know there are many things that could be done and could be done quite easily, quite rapidly, in order to change what would be the diagnosis for children, what would be the access to care, what would certainly be the kind of supports that are available, and in fact doing a better job to getting them access to treatments that are available. So we're really, really excited with the opportunity to actually have a designation for Rare Disease Day, because it does recognize that rare diseases doesn't just affect the families and doesn't just affect a small sector of that population. Rare diseases affects everybody. It is a major issue, and the designation of Rare Disease Day will help to bring in the healthcare professionals, but also bring in all the other sectors to help us make sure that parents, families that are dealing with rare diseases don't feel like they're dealing with this alone, and that we can bring in solutions that are going to be implementable and also have immediate benefits. We do have a long-term goal, and we are so very, very pleased to have the opportunity to be here with Michael and certainly with the government in terms of the ways in which we can all work together towards improving the situation. This is the 12th official Rare Disease Day in the sense that 2008 was the first year. But as we all know, because leap year only happens once every 4 years, this is actually only the third time that we've actually had Rare Disease Day. So in many respects, it is in fact a new issue, and this is a wonderful opportunity for Ontario, hopefully, to begin to embrace Rare Disease Day as in fact an official day. So thank you very, very much, Michael, not just for this, but for all the work that you've done, all the awareness that you've been doing, all the visits with families that you've had. We've heard tremendous things in all of the town halls that you've hosted, and I think people just are very grateful for all the support that's coming forward. So hopefully together we'll make some great things happen.
Absolutely. Well, thank you, Durhane. And that concludes our little press conference. Appreciate
Thank
it. Thank you.
Thank you.